And we're looking in the cecum here, just attached to one of the lips of the ileo-caecal valve is a polyp. But it's not just attached here, it's right around into the base of the cecum. And the question is, whenever you see a polyp in the cecum, where's the appendiceal orifice, where's the ileal opening? So I guess the first question to ask is, has the patient had an appendectomy? I think here we think that the patient has not had an appendectomy. Appendicectomy if you're from the UK. And the second thing you want to know is how much of the ileum it involves. Because why are these two things important? Because they determine the chance that you're going to be successful at this. I mean, obviously you need to be able to do polypectomy. It's a whole other topic, but even if you can and you're an expert, the fact that this involves multiple or full circumference of the valve will make it less likely that you succeed. Here, I think you can see that the margin is really here onto the ileal mucosa. Actually very difficult to see, a bit of trauma from before, for which we are sorry. That's maybe more obvious, actually not obvious with MBI. So because of the bleeding and the prep, MBI is not helping, but I think we've seen that margin. And then there is this little depression. So my colleague standing with me, who just had a look at this before I did, mentioned that maybe there's a demarcation zone or a depression here. And I think she's right, but it's just behind the lip of the valve. And here we want to see whether that is indeed something for, is it because of invasion or is it just a depression? All right, so we'll get on and do that. Yeah, let's have an injector. You can stop that for me. I'll leave it, we may use it later. But we've stopped it. The 15 captivator. This is going to be difficult.
Yeah.
There's no doubt about it.
Do it in
So, you want to always, if you're doing this kind of thing, you want to always start on the ileum. Well, you need to find the orifice. Well, yeah, because also if it's extending into the appendiceal orifice, then you need to think about that. Well, the options are full thickness or surgery. And would it be better maybe if it involves both? Probably it's better that the patient has surgery because you get it in one go. Open. So really you've got to inject this margin. Open. Yeah, it's open, sorry. Inject here. And you really got to expand it for our first snare placement. And maybe we're going to use a 15 here, maybe it's too big. We'll find out. But you really need to make an imprint on this margin and make sure it's polyp free. So work on your snare technique, make sure you can see the V, make sure you're pressing down, get the fluid out of the way. Don't take that much. Use suction to your advantage right now, slowly. Close. So we're using a 15 snare, but we have got tissue. Where's the pedal? Okay. So yeah, I would not score so well for preparation on my G-pad here because I haven't checked the pedal is available. Go a little tighter with the thing. Cut it off with the next one thing. Injector. So now we made an imprint there.